Now, this is all about the kids and making sure they get the medicines they need. And so, as we know, Western New York has been walloped with snow and cold the past 2 weeks. And with cold weather brings the risk of respiratory viruses that particularly affect our children and our babies. From the flu to COVID, we have seen these viruses, but what brings me here today is a particular virus called RSV. Now, I'm going to say the name once. No one knows that middle S word. It's called respiratory syncytial virus, RSV. So with the cold, there's an increased risk of RSV, which hurts the kids particularly. It's dangerous to them and to the elderly. Now, the best way to protect yourself from this disease is get vaccinated. I get vaccinated every year. I encourage everyone to do so. And many people do not know that if you're on either Medicare or Medicaid, the vaccines are free because of the work we did in what was called the IRA. And I forgot to button my tie. Sorry about that. Anyway, so those vaccines are free for anyone on Medicare over 65 or on Medicaid. But when it comes to the RSV vaccines that protect our children, many of our pediatricians, like those here at this great clinic, Western New York Pediatrics, are in impossible situations. Why? There is a severe shortage of this much-needed RSV shot. It's called Beyfortus. And parents are in agony when they know their kid might have it or going to get it and they can't find the vaccine. There's nothing that you ache more than you worry about your children. As first name again? Dana will tell you, and even Reese would tell you if she could talk. The RSV vaccine is brand new. It was just developed last year. And it's sort of a miracle that everyone's excited for because it did so much good with virtually no bad side effects. So it's a very good virus. But many Western New York parents are coming in to try and get the shot for their kids and told they must wait weeks or even months because of the severe shortage of this new vaccine. It's true nationwide. The demand has surpassed the very limited supply, and the RSV cases has slowed a little bit recently, but in cold weather it's worse. Why is it worse? Because people are indoors, so the virus spreads much more easily. So the colder it is, the more likely we are to get it. And we have had a very tough few weeks with snow and cold here in Western New York. And so I am today launching a two-pronged plan to help Western New York and all of upstate New York get this virus vaccine, which is so necessary. It's a two-pronged plan to help address the vaccine shortage we're seeing here in Western New York. Now, first, I am sending a letter to the CDC. It's a copy of the letter. See it? See it, Reese? What a cutie. Where'd you get that cute little bow? Very smart and cute at the same time. She's both smart and cute. Anyway, so I'm sending a letter to the CDC and FDA saying get the shots to the places that need it most. And we in Western New York are at the very top of the list in terms of needing it most. Get it into the hands of physicians so that they can get the vaccine and give it out to the kids right away. Get the shots out fast. The feds are trying to do this, but they already expect, and they expect 230,000 new doses to be available. We want Western New York to be at the top of the list because we have the greatest need here, because as I said, the colder it is, the more likely it is that you need the vaccine, because when you're indoors, the virus spreads. So get that new batch out. But second, I'm also calling on the manufacturers to work with the federal government to speed up production of this vaccine. Given the cold weather, given the great demand, and given that RSV can be serious, we need them to speed things up ASAP. That means the feds have to work with the manufacturer so that the supply lines are moving more quickly because they need certain ingredients to make that vaccine, and some of those ingredients are slow. Okay, manufacturers and feds can work together to ensure that bureaucratic hurdles and regulatory hurdles aren't getting in the way of getting the vaccines out. Make sure those supply chain issues don't persist so there won't be another spike in the shortages. Here at Western New York Pediatrics alone, staff has been forced unfairly, has unfairly been forced to make decisions on who gets the vaccine and who doesn't. That's not right and that's not fair, and good doctors and good nurses don't want to have to make that choice. That's like triage, and that's a bad thing. There have been parents looking to pay cash up front to expedite to get the vaccine, and I know that Western New York Pediatrics is certainly not the only local office dealing with these problems. We can't let this become a crisis. With everyone working together, we can prevent these shortages. As a grandfather of 3 beautiful young children, 5, 1.5, and 10 months, there's nothing more terrifying for a grandparent or a parent than the thought of them getting sick, and getting sick with something that's fairly serious, RSV. And so we don't want that stress for the parents waiting, and we certainly don't want the kids who need the vaccines and the babies and the vaccines not to get it. I've known people whose babies, only a few months old, are spending more than a week in the hospital. The babies suffer from collapsed lungs, and they need oxygen. They need a little mask. I've seen a picture of one from a friend of mine to keeping their parents stay at vigil over bedside, worried that breathing will stop. One of my friends whose kids had this stayed up all night because you're worried if the breathing stops. God forbid, God forbid. One mother in Western New York who was waiting on the vaccine for her child, and while they were waiting, the child got sick with RSV. They're okay, but that was terrifying to them. So we need all hands on deck. One, with the existing vaccines, go to the areas that need it most, Western New York at the top of the list. Number 2, get those supply chain bumps eradicated so we have more vaccines and everybody could get it. Parents should never have to hear there's not enough medicine to keep their babies safe. RSV is treatable. It is treatable, and we recommend people get the vaccine. No side effects. But we need our hospitals and our medical clinics to have a steady supply. With that, I'm going to call on our first guest. Are you, doctor? Are you? No. Are you first?
Colleen. Yes.
Thank you, Colleen. You're first.
Okay.
Our great doctor and head of
Yes. Hi. Thank you very much for coming. Thank you, Senator Schumer, for calling attention to this. You know, from the pediatrician end, I just can't emphasize some of the words that were just said about how serious RSV can be if babies, especially if babies get this. In many of us, it's just can be a common cold. It's a virus that sticks up in our noses, causes congestion, a tickly throat. But in many people, especially babies, it can travel down into the airways. It can infect your big breathing tube, your smaller breathing tubes, and then your lungs. So you get this horrible cough, this tight, wheezy congestion that babies can get. They struggle to breathe. And then if it's in their lungs, that's pneumonia that's been talked about. And then it interferes with oxygen exchange in those babies. And they can't eat, they can't bottle or nurse if they're breastfed. So it's really, really a bad disease. It's highly contagious. And with this vaccine, it's actually a shot. It's given to babies, it's a one and done. It's given to babies 8 months and younger during respiratory season. So 8 months and younger, from October through I'd say March. If you're that age, that's who's supposed to get this shot. And it's passive antibody. So we're actually giving these babies antibodies against RSV. So when they get the infection, because it's really contagious, the RSV goes in, they're already armed with antibodies. The antibodies neutralize the RSV virus, and they have a very mild infection. It's 80% effective in decreasing hospitalizations. It will decrease the burden on our healthcare system. Oshai Children's Hospital has been overwhelmed. So it's a wonderful product. It's a wonderful way to prevent RSV, which is a really highly contagious, serious respiratory illness. And as Senator mentioned, our barrier was at not getting enough vaccine or shot to offer our babies.
Thank you, Dr. Matamore.
Yes, sir.
She knew it very well. And one thing she should mention, I didn't mention, it's highly contagious.
Yeah.
And if you're an adult, you think you have a cold. But your child could be susceptible to something far more serious, which is RSV. Okay? All right. Next, we have a nurse here, Rachel Balancino. Rachel, thank you.
Hello all, my name is Rachel Balancino. I'm the nurse supervisor here at Western Pediatrics in charge of ordering vaccine and supply. Thank you all for being here to shed light on this important topic. Just as far as my perspective, this has been unlike any previous experience in regards to availability of the RSV shot, making it impossible at times to have adequate supply for our patients in need. We need help with accessibility of the RSV shot, so pediatric offices like Western Pediatrics can help safeguard our most vulnerable patients like Reese. So, thank you.
Thank you, nurse. And now we have the star of the show, Reese, and beautiful Dana, who fell asleep. Look at those little beautiful fingers. I love kids.
I can only speak to our experience, but our daughter Reese is 5 months old and she has Down syndrome, and so we were especially concerned of her being at a higher risk. We also have a 2-year-old son at home who did get sick with RSV when he was 10 months old, so we fully could understand the severity of her potentially getting sick with RSV. So as soon as we could, we were very persistent in trying to follow up with anyone we could to find the proper dosing for her so that we could do as parents as much as possible to hopefully protect her from, like as you said, hospitalization or something more serious. So we can't thank everyone here at Western New York Pediatrics enough for going above and beyond and finding the right dosing for her so that she could have it back in November. We are very grateful as parents that we
Thank you.
did as much as possible.
Thank you.
And we hope other parents too can have that advantage.
That was great. Well said. Thank you very much, Dana. You're a good natural here, as is Reese. Okay, we'll take questions on this subject.
So, from the pediatrician side of it, I mean, have you turned folks away at this point?
Yes. So yes, and Rachel can speak to this. So we've had we've been allocated the shot. It's not quite a vaccine, it's a shot because you're giving babies antibodies, which is a beautiful thing. So usually Rachel would order vaccine based on patient need. We have this many babies, this many need it, we place the order, it's delivered. What happened is the bottom fell out and there was a shortage of nirsevimab or Beyfortus, and all of a sudden we were told you can't get what you ordered, you can only get small amounts, and it varied from week to month, so that every day we have a board in the back that shows how many we have. Like right now, we only have one left for babies. One left.
And how many patients do you see
we
a
had
week
5
here?
babies today.
Yeah, there you go.
So, and Rachel struggles because it's just not there. So yes, we've had to allocate, and the AAP, American Academy of Pediatrics, the CDC, has set some guidelines to help pediatricians because it's a horrible position to be in to
Right.
make that decision.
Yeah. So the shortage, as you can see, is pretty severe. This is not just a little.
Is there any supply coming back here? I mean, with that one just
The-
sitting right now, do you expect it?
I don't know, Chris,
this
have you
week,
heard
next week?
anything? But the AP did I looked yesterday and
That's
on
the Association of Pediatricians.
So it's a national organization. They're hoping there'll be more supply at the end of January. But that's all we know.
Yeah, and if they speed up the supply chain, we won't have this problem again. So that's what they've got to do. It's not just the manufacture of this, it's called Beyfortus, but different chemicals go into making the vaccine, and there's a shortage of them. So that's what they need to speed up. Any other questions on this subject? Go ahead.
Are they going to need money, funding? What do you think will
It's not in money, it's, I mean, we can advance money that they get paid back once they have the disease, once they have the vaccine. But it's really just getting them to work more around the clock. Keep the factories open, keep the supplies going, don't be 9 to 5, because it's an emergency. Okay?
Has it peaked here as far as, you think everything we're gonna have another spike?
Right now, according to the recent data on NPR this morning, it's slowing down. I know that OSHI, they're wonderful. They communicate with the pediatricians locally about what they're seeing in the ERs, their admissions, and it's still in relative crisis mode with the respiratory illnesses. It's not just RSV, but COVID and the flu.
Yeah,
Okay.
I was gonna ask, is this an RSV vaccine specific issue, or is it
Yes.
a supply chain issue?
It's a supply chain, but the RSV is particularly short, and it's more dangerous, frankly. RSV is more dangerous if it gets into the baby's lungs. So it's both. More of a shortage, more of a severe need. Okay? And Channel 7, you had a question on the post office,
Yes,
right? I
I
said
did.
I'd do that.
Thank you. What can be done? I know other, obviously, communities across the country are probably fighting for theirs as well. What can be different here for Western New York? We've been through this battle before to save this post office.
Yes, I was involved. So let me just say first, we don't know what their plans are yet. They're going to announce them on January 31st. But if there's any attempt to close, reduce, shut down number of employees or mail service, I will fight it tooth and nail. They tried this about 5-6 years ago. I fought it tooth and nail, and we succeeded in keeping the post office open fully. I hope to do that again.
The community feels like it's kind of been like this hidden,
Well,
agenda that they've had.
We're not going to let them close it down behind closed doors, believe me. Post office comes to me with all kinds of needs, and just like I was successful whenever, several years back, I believe I'll be successful again. Leave our William Street post office alone. It's doing a good job. We don't need them cut back.
What can the community do in the meantime?
Make your voices heard, and there's going to be a hearing on October 31st here. Sorry,
January 31st?
January 31st. Sorry. There's going to be a hearing here on January 31st. Come. Okay? Thank you, everybody. Have a good day. Thank you. Appreciate it.